This video contains everything you need to know about coenzyme Q10. What is it used for? What are the clinical indications to use it? The mechanism of action behind it? And why patients who are taking statins, cholesterol-lowering medication, need to use coenzyme Q10. So let's get straight into it. Coenzyme Q10 is naturally produced by our bodies. They are found in organs that need high energy production, especially heart, brain, and muscles. They are vital for energy production and antioxidant defense. Always remember, coenzyme Q10 is for energy production and for antioxidant defense. It is also called ubiquinone. It is present in two different forms, ubiquinol and aubiquinone. The reduced form is called ubiquinol. Before I talk about the mechanism of action, let's talk about the biosynthesis of coenzyme Q10 inside our bodies. You can see that it has the same precursors as cholesterol. It starts with acetyl-CoA, and then you continue, and then this is the most important enzyme in there, HMG-CoA reductase, since statins inhibit HMG-CoA reductase, which results in lowering cholesterol. But with that, it also lowers coenzyme Q10. Farnesyl pyrophosphate, FPP diverges into two different pathways. One of them is to produce coenzyme Q10, and the other pathway is to produce cholesterol that is not shown here. Coenzyme Q10 is able to take and donate electrons easily, so it's a mobile electron transporter. It accepts an electron from complex 1 and 2, and also it donates an electron to complex 3. Through this movement of electrons, we can see that there is a driving force of protons from the matrix or the mitochondria into the intermembrane space. This proton gradient is called proton motive force. The proton motive force is like recharging a battery. The more proton gradient you have, the more that the battery is charged. And ATP synthase uses this energy to synthesize ATP. It's that easy. And as we said, since it has a great ability to accept and donate electrons, it is a great antioxidant. You can see that it also regenerates other antioxidants such as vitamin E and vitamin C. So what is the relationship between coenzyme Q10 and statins? As we know, statins inhibit HMG-CoA reductase, and this results into its cholesterol lowering effect, but also this lowers coenzyme Q10 production. So because of that, the person who takes statins suffers from lower energy, and also the muscles suffer from myopathy, since we see an increased production of free radicals, which damages the lipids, proteins, and the DNA of the muscles. And in severe cases, we can see that myopathy results in myolysis, where the person starts to lose his parts of his skeletal muscles. This effect is not well established in the cardiac muscles. Some people experience cardiomyopathy, but it's less common. Usually the effects are either in the CNS, where they have less energy, but it's most commonly found in the skeletal muscles, where you have myopathy due to overproduction of free radicals and the presence of less energy. So when a person is taking coenzyme Q10 supplementation, you need to make sure that this person is not taking warfarin. If a person is taking warfarin, this decreases the efficacy of warfarin. Patients that take warfarin, they have a consistent vitamin K intake. And if they have an increase in taking vitamin K, this would increase the INR value. Because coenzyme Q10 has a similar structure to vitamin K, we can see that it can also activate the clotting factors 3, 5, and the other clotting factors that are activated by vitamin K. So therefore, it should be consciously used on patients that are taking warfarin. You should always monitor the international normalized ratio, or INR, while taking coenzyme Q10. The usual dosage for coenzyme Q10 is 100 mg to 200 mg per day, and it also can be increased to 300 mg per day. The usual form that is used is ubiquinol, and it's also when you take it, it's better to take it with anything that contains fat, so take it with fatty meals, or you can take it with milk. For the side effect profile, is generally mild. As we said, the body produces it, so generally, if the patient is indicated for the use of the supplementation, is usually because he has clinical symptoms that indicate he has a deficiency in coenzyme Q10. So usually you don't have any severe side effects from taking it. Sometimes you get some allergic side effects, but it's really rare. The mild side effects are nausea, diarrhea, and insomnia. So, the clinical indication that leads you to prescribe coenzyme Q10 are when a patient is taking statins, chronic fatigue or low energy. As we said, coenzyme Q10 is essential for energy production inside the cell. Cardiomyopathy or heart failure, migraine prevention. The reason why it's effective for migraine prevention is because a migraine attack might be the result of an increase in free radicals in the CNS or metabolic issues inside the CNS that causes a migraine attack. So, if a patient that suffers from migraine attacks, it might be wise to consider taking coenzyme Q10 as a method to reduce future migraine attacks or decrease their severity. Also, aging-related decline in mitochondrial function requires the intake of coenzyme Q10. And lastly, there is no standard lab test for coenzyme Q10, so your whole judgment would be based upon clinical symptoms that the patient is showing and the history of the patient and the medication that the patient is taking. That's it for today. This is my first video, so I'm kind of nervous. Thank you for watching, like and subscribe, and also if you have any note about the way I'm making my videos, the slides, and any recommendations you can provide me, write them in the comments. Thank you for watching.